The 10 simple give reasons or the 10 important give reasons from thyroid gland related disease condition. The first question, a tracheostomy set must be kept at the bedside after thyroidectomy because postoperative neck swelling or hematoma can cause airway obstruction and need immediate airway access may require. The second question, the nurse checks for chopsticks and trouser sign after thyroidectomy because accidental removal or damage to thyroid gland or manipulation of thyroid gland may cause hypocalcemia which produces these two main signs. The third question, the patient's voice is assessed frequently after thyroidectomy because injury to the laryngeal nerve can cause hoarseness or loss of voice. The fourth question, the semi-fowler's position is maintained after thyroidectomy because it reduces the neck swelling, decreasing the tension on suture line and promote breathing. The fifth question, the nurse monitors for sudden neck swelling because it may indicate a postoperative hemorrhage that can compress the trachea, means that can compress the airway. The iodine or SSKI is given before thyroidectomy because it reduces the vascularity of thyroid gland, so reducing the bleeding during the surgery. And also one more thing we can remember is that iodine is contraindicated during pregnancy because the iodine may destroy or necrotize the fetus thyroid and cause permanent hypothyroidism. The seventh question, the patient is advised to avoid coughing or neck flexion after thyroidectomy because this action can increases the pressure on suture line and cause bleeding, and the bleeding may cause airway obstruction. Eighth question, injection calcium gluconate should be available after thyroidectomy at the bedside because it treat acute hypocalcemia results from parathyroid damage. Ninth question, the nurse observed for difficulty in swallowing postoperatively after thyroidectomy because it can indicate neck swelling or hematoma, compresses the trachea or esophagus. The 10th question, the patient is advised to support the neck with hand while rising from the bed after thyroidectomy because it prevents strain on the surgical site and avoid suture line tension. Give reasons questions from endocrine. The first question, hyperthyroid patient have heat intolerance because the increased metabolic rate produces excess heat, make the patient feel hot. The second question, weight loss occurs despite increased appetite in hyperthyroidism. The answer is high metabolic rate burns the calories rapidly leads to weight loss. The third one, exophthalmos occurs in Graves' disease because the autoimmune inflammation increases the fat and fluid behind the eyes, push them outward. The fourth question, patient with hyperthyroidism experience tachycardia and palpitations. Answer is the excess thyroid hormone increases the sympathetic activity and heart rate. The fifth question, hyperthyroid patient feel anxious and restlessness always because the thyroid hormones overstimulate the nervous system, causing irritability and anxiety. The sixth question, diarrhea occurs in hyperthyroidism because increased metabolism speed up the GI motility leads to frequent stool passing. The seventh question, patient with hyperthyroidism often have warm, moist skin. The answer is increased blood flow and sweating result from elevated metabolism. The eighth question, a beta blocker, example, propranolol is prescribed for hyperthyroidism patient. Answer is it in control the symptoms like tremors, tachycardia, anxiety by blocking the sympathetic effects. The ninth question, radioactive iodine therapy is avoided during pregnancy. The answer is it destroys the fetal thyroid gland and cause hyperthyroidism in fetus. The 10th question is high caloric diet is recommended for hyperthyroidism patient. The answer is the patient burns calories rapidly due to high metabolism and need extra energy too. The 10 main give reasons from the topic hypothyroidism. The first question, hypothyroid patients feel cold easily. Low thyroid hormone reduces metabolic rate, decreasing the heat production. The second question, weight gain occurs in hypothyroidism due to slowed metabolism leads to fat accumulation and fluid retention. Third question, constipation is common in hypothyroidism. Decreased metabolism slow the gastrointestinal motility. The fourth question, the skin become dry and rough in hypothyroidism. Reduced sweat and oil gland activity causes dryness. Bradycardia occurs in hypothyroidism. Low thyroid hormones slow the heart's metabolic activity. The sixth question, hypothyroid patient experience fatigue and lethargy. Decreased metabolic rate causes low energy production may cause fatigue and lethargy. Myxedema causes facial puffiness. Accumulation of mucopolysaccharides in the tissues leads to edema. The eighth question, levothyroxine is given early in the morning. It is the best absorbed on empty stomach and mimic the natural morning hormone peaks. The ninth question, hypothyroidism can cause menstrual irregularities. Thyroid hormones influences reproductive hormones. Low level disrupt the cycle. The 10th question, myxedema coma is a medical emergency. Severe deficiency of thyroid hormone depresses the cardiac and respiratory function, causing life-threatening complications. 10 main give reasons from the topic hypothyroidism. Hypothyroid patients feel cold easily because low thyroid hormone reduces the metabolic rate, decreasing the heat production. The second one, the weight gain occurs in hypothyroidism. Slowed metabolism leads to fat accumulation and fluid retention can increases the weight. Third question, constipation is common in hypothyroidism because decreased metabolism slow the gastrointestinal motility. Skin become dry and rough in hypothyroidism patient. Why? Reduced sweat and oil gland activity causes dryness. Everything may decreasing. So the fifth question, bradycardia occurs in hypothyroidism. Low thyroid hormone slow the heart's metabolic activity too. The sixth question, hypothyroid patient experience fatigue and lethargy because decreased metabolic rate causes low energy production. Then seventh question, myxedema causes facial puffiness. Accumulation of mucopolysaccharides in the tissues leads to edema. Levothyroxine is given early in the morning. It is the best absorbed on an empty stomach and mimic the natural morning hormone peaks. Ninth question, hypothyroidism can cause menstrual irregularities. Thyroid hormone also influences the reproductive hormones, so the low level disturb the cycle. The 10th main important question is, myxedema coma is an emergency, medical emergency. Severe deficiency of thyroid hormone depress the cardiac and also the respiratory function, causing life-threatening complications.